Hello everyone! Welcome again to my YouTube channel. Ito'y very special day na gagawin kong video para ito sa mga healthcare providers, sa mga buntis, sa mga breastfeeding mothers dyan na I know every time you go to the rural health unit sa inyong community, you always have a conversation sa mga healthcare providers. So, this is specifically para sa mga rural health unit, healthcare providers, at sa mga nanay at sa mga buntis na pumupunta sa mga rural health units to have your check-up, to have your assessment. Kaya I'm giving this time, sabi ko sa sarili ko, anong kailangan yung malaman o matutunan when it comes to prenatal check-up, prenatal assessment, breastfeeding preparation. So, inaalay ko ito sa mga hardworking nurses sa ating bansa, sa mga hardworking nurses sa rural health units everywhere in the Philippines, at sa mga nanay, mga nagbubuntis na nangangailangan ng tulong. So, I'm gonna talk, first of all, I want to talk about how you're going to prepare. Okay, kung planning mo, if you have a plan right now na gusto mong magkaroon ng baby maybe this coming new year, or buntis ka na ngayon, and you still have some preparation na hindi mo pa nagawa. So I think this is the best time na give me 15 minutes of your time at sasabihin ko sa inyo kung ano yung dapat gawin. And for those of you healthcare providers who's gonna be doing prenatal teaching, kailangang i-cover nyo kung ano yung mga important things na kailangang malaman nitong mga buntis na to, itong mga nanay na to. Now, first is preparation. What is the most important thing talagang gagawin mo when it comes to pregnancy? The first thing that really comes into my mind right now is your nutrition. Dahil if you're buntis or planning to get buntis, or if you're breastfeeding, and you have poor nutrition, maraming komplikasyon, maraming problemang madadaanan ang mga nanay kung wala talagang sapat na nutrition. Good nutrition. So, why? If you're buntis right now, I know you have multivitamins you're taking every day. You're very lucky that the government, you can get it from the healthcare unit. I'm pretty sure. Other than your multivitamins that you take daily, kailangan nyo pa talagang kumain ng masustansyang nutritious food para maging healthy ang baby nyo. Because every time na ma-abandon yung good nutrition natin, the number one thing na makaka-affect talaga sa baby is the neurological development. Yung utak ng baby talaga ang kailangan talaga nating ingatan. Hindi lang sa sarili natin, yung dinadala natin. Because every time napuntis si nanay at kulang na kulang sa nutrisyon, kaya nagkakaroon tayo ng mga batang may mga complication cognitively sa pag-iisip because dahil sa hindi masustansya yung kinakain natin. And the worst thing is, dahil dito sa crisis na naranasan natin, there are so many families right now who cannot afford to eat healthy every day, to eat 3 times a day. Yun ang pinaka-problema ngayon. So as a healthcare provider, kung ikaw'y nagtuturo ng prenatal class, or ikaw ang nanay ngayon na you're buntis now and then sa hirap ng buhay, you need to find a way on how to feed that baby inside you. Dahil marami talagang mga nangyayaring komplikasyon. When you gave birth, there are so many babies in the world right now born as a preterm. Premature, because again, poor nutrition can also lead to much premature delivery. Okay? So, kailangan talagang isipin nating mabuti ano yung dapat kainin na healthy, na hindi maapektuhan yung baby natin, okay? Another thing that you really have to prepare at kayong mga nurses when it comes to you're doing assessment and preparation for breastfeeding, you need to make sure na itong blood pressure ng nanay na to ay maintained. Because the minute when you're pregnant, and your blood pressure is sky high, your blood glucose sugar level is high, guess what? When you give birth, you don't get that much milk, because every time your blood pressure goes sky high, it goes down your milk supply. Every time your blood sugar goes sky high, it goes down your milk supply. And guess what? When your blood pressure goes very low, pag mababa yung dugo mo, na maputla ka na, anemic ka na, guess what? Your milk supply will go down as well. So, as a healthcare provider, ito talagang ituturo nyo lagi. Monitor blood pressure, monitor blood sugar, at kayong mga nanay, make sure talaga na iwasan nyo yung mga maalat na pagkain. Because you know why? Every time you eat that delicious tuyo, daing, whatever, bulad, or uga, or whatever you call it, lahat na maalat na pagkain ay talagang nakakasira sa ating katawan. Especially if you're pregnant right now. Now, when it comes to breastfeeding preparation, sa mga healthcare providers, make sure you have physical assessment na gagawin nyo sa mga nanay when you do your prenatal checkup. Dahil these nanays, this buntis, needs to know kung ano yung dapat nilang i-prepare when it comes to pagbubuntis, when it comes to breastfeeding. Dahil kalimitan sa mga pasyente ko in my breastfeeding clinic, doon nila nalalaman when they come to a breastfeeding clinic, when I do their physical check-up for their breast, na may diferensya pala sila sa breast. Hindi nila alam. Now, the baby is here now, they're struggling with breastfeeding, hindi nila alam anong gagawin, they don't know what's wrong with them, kaya nangyayari, hindi tuloy nagiging effective yung breastfeeding. So, as healthcare providers, as mga nanay, as much as you can mga nanay, mga buntis, ask question. Every time you ask question from us, kaming mga nurses, kaming mga healthcare provider, we are able to give you information and you'll be able to prepare what you need to prepare. Dahil kalimitan kasi sa mga nanay, nagre-rely din sila kung anong nababasa nila. So, hey, not everything what you read in internet are real, are good facts or true information. Dahil anyone can post any information kahit hindi evidence-based information. Kaya ako ginagawa itong video na to dahil maraming mga nanay nagme-message sa akin, maraming mga buntis nagme-message sa akin, longing for that right answer doon sa mga tanong nila. So, kaya ako ginawa itong video na to para maliwanagan kayo kung ano yung dapat i-prepare nyo. You prepare the tools that you need. Kung kailangan nyo ba ng breast pump, yun ang tanong nyo. Why everyone is buying breast pump? Kahit sobrang mahal, kahit yung iba hindi gumagana. Do you really need to buy a breast pump? Yun ang tanong. But if you can afford to buy it. Pero ang pinaka-importanting i-prepare nyo, na i-guide nyo yung mga buntis na or mga bagong panganak is proper latching, proper positioning. Yun ang kailangan natin. Hindi natin kailangan tumakbo ka agad kukuha ng breast pump. Because breast pump is only a tool that's an option when this one doesn't work. However, maraming paraan na makakatipid ang mga nanay, makakatipid kayo kung hindi kayo bibili ng mamahaling breast pump. Dahil mahalang breast pump, I knew it. The best quality of breast pump ay yung pinakamahal. Kung bibili ka lang na yun ng breast pump na pipitsugin lang o mumurahin lang, because you pay for the amount that you pay, kung anong quality ng breast pump na yun. So, you have to think first before you spend so much money preparing for this and that. When it comes to mga gamit ni baby, hold on muna hanggat nandyan ang baby, because you never know kung masyadong maliit si baby, yung binili yung damit is too big or too small. So, you never know, bibili ka ng breastfeeding bra na yung breast mo, you never know kung anong size ng breast mo after maybe 2 weeks kung paglabas na ng milk nyo. So, nagsayang ka lang ng pera. So, these are the preparations that you need to do. If you're pregnant right now, if you're planning to breastfeed, if you're planning to do mixed feeding, plan. But always make sure buy the things that you only need. Hindi want, okay? Kasi yung want, ginagaya-gaya lang yun kung sino yung si Kumari meron, gagayahin ko rin. That is a want. That's not really what you need. What you need is teaching like this, what I'm doing right now, how you properly latch. Watch my previous video on how to latch, how to position, what to do if you have C-section, what to do kung may tear ka doon, kung may hiwa ka down there after birth. So those are the things that you need to prepare. And kudos sa mga rural healthcare providers who are doing a good job, who work so hard during this pandemic. I know talagang lahat ata tayo naging busy because of this pandemic. So I'm so happy I have this platform na ma-share ko sa inyo mga healthcare providers at sa mga nanay at sa mga buntis na there is hope. And I think I'll be a part of your hope dahil iko-continue ko yung journey ko in this YouTube channel to help so many moms out there who have problem breastfeeding and to help those healthcare providers na nangangailangan ng extra boost ng knowledge ninyo on how to provide prenatal care and provide you breastfeeding strategies so that you can help millions of moms sa ating bansa. Thank you for watching. I'm going to say every 2 to 3 days, you're going to be watching more videos from me for breastfeeding and about pregnancy. Follow me. Do your comments if you have any questions. Don't feel free to ask me any questions you want about breastfeeding, nursing, and education. Bye for now. Maraming salamat for watching and you take care. Be safe.